When world leaders adopted the 2030 Agenda for Sustainable Development in September 2015, they envisioned a present and a future that is economically sustainable, socially inclusive, and environmentally resilient. That vision is expressed through the framing of the 17 Sustainable Development Goals, 169 targets, and 230 key performance indicators. Broadly, the SDGs are a universal call to action to end extreme poverty, safeguard the planet, and ensure all people enjoy peace and prosperity by the year 2030. So when world leaders adopted this agenda in September 2015, Nigeria acted very quickly in the overall implementation of the SDGs. And that happened with the establishment of appropriate institutional framework at the national and at the subnational level to guarantee effective implementation of the SDGs. So as part of Nigeria's commitment to the 2030 agenda, in 2018, December, Nigeria participated at the regional workshop on Sustainable Development Goals evaluation in Addis Ababa. And Nigeria showcased its institutional framework and also, along with other member countries, advocated for country-led evaluation of the SDGs. And it is important because in Nigeria, one of the core mandates of the Office of the Senior Special Assistant to the President on Sustainable Development Goals is that of monitoring, evaluation, documentation, and reporting for the SDGs. So to give that mandate the needed impetus, in the wisdom of Her Excellency Princess Adejoke Orologbe Adeflure, the Senior Special Assistant to the President on Sustainable Development Goals, commissioned the independent evaluation of priority SDGs. And so in January 2019, in partnership with the Federal Ministry of Finance, Budget and National Planning, and other relevant ministries, departments and agencies, with technical and financial support of the United Nations Children's Fund, UNICEF, we commenced the capacity building activity for SDG-based evaluation in Nigeria. In that capacity building workshop, we brought in all the key stakeholders from the relevant ministries, departments, and agencies for a 5-day capacity building workshop. During that workshop, participants happily prioritized 5 reporting SDGs for the purpose of conducting evaluation. And I remember that was SDG 1, SDG 3, SDG 4, 5, and SDG 8. So having conducted the needed scientific, methodological, and conceptual understanding of what we need to do to evaluate the SDGs, being that no other country has commenced that process at that time. And we were trying to operationalize, if you like, the SDGs. We ended up prioritizing 3 SDGs, SDG 1 on no poverty, SDG 3 on qualitative health and well-being, and SDG 4 on qualitative and inclusive education and lifelong learning for all. Following that evaluation capacity building workshop, we commenced work by setting up the technical working group for the SDG evaluation in Nigeria, involving all the key stakeholders from the ministries, departments, and agencies that are relevant. And then we began to work, and with the technical and financial support of UNICEF, we began the process of independent evaluation of the 2 priority SDGs, SDG 1 on healthy lives in Nigeria, and SDG 4 on qualitative education and lifelong learning for all. In the process, we looked at the national policy on education and that of health, and made sure that they mainstream the SDGs into their sectoral policies and plans. So this is a policy evaluation and we are happy to say that Nigeria is the first country in the global south to have successfully conducted this exercise. The methodological approach and why the evaluation is basically about evidence-based reporting for the SDGs, learning and accountability. And these are all embedded in the transformative promise of the 2030 Agenda for Sustainable Development, and that is to leave no one behind. So we needed to understand what is working and what isn't working, and then how best we can use the key recommendations from the evaluation to improve policy implementation for the SDGs. In the process, we have been to a lot of international forums to share our conceptual and methodological approaches with other United Nations member countries, also learning from the experience of Finland being the first country in the global north to have successfully conducted evaluation of sustainable development. So today Nigeria is leading on the global south in terms of successfully conducting independent country-led evaluation of diseases. And we are also leading and spearheading other member countries at the United Nations to get a standalone United Nations resolution on country-led SDG evaluation. It is a clear demonstration of Nigeria's commitment to the 2030 Agenda for Sustainable Development. This report will be launched by His Excellency, the Vice President of the Federal Republic, on the 25th of August 2022, and all key stakeholders will be in attendance. All the relevant ministries, departments and agencies, the diplomatic and international community, and more importantly, the subnational governments, because the evaluation, it's a national evaluation, and we had to select a number of states to conduct primary research to ensure that, like education and health are on the concurrent legislative list. The federal and the subnational governments are all involved. And so the report is it's the first of its kind in Nigeria, and we hope that going forward we'll be able to extend a similar methodology and approach to evaluating other SDGs in Nigeria. When world leaders adopted the 2030 Agenda, they set up a follow-up and review mechanism, which we now know as the High-Level Political Forum on Sustainable Development. It is follow-up and review mechanism to hold themselves accountable for their commitment to the 2030 Agenda. And therefore, countries are encouraged to voluntarily review and report their implementation of the SDGs periodically to the United Nations Economic and Social Council. And the voluntary national reviews are more useful and helpful when they are evidence-based. And the only way to do an evidence-based voluntary national review, which Nigeria did, the first one in 2017 and the second one in 2020, is through a country-led evaluation. You must be able to evaluate what is being implemented and then report on evidence base. So one of the key, if you like, objective of the evaluation is to enable countries to do evidence-based voluntary national reporting. And then secondly is also that of learning and accountability. Okay, ministries, departments and agencies have the mandate to integrate and mainstream the relevant SDGs into their sectoral policies and plans. So the only way to be able to understand what is happening is through evaluation, and that is impact evaluation. And this evaluation will tell us what is working and what is not working. But more importantly, the key recommendations will be used for policy advocacy around the SDGs. So it is about strengthening the implementation of the SDGs across the country as we are just 8 years into the finish line. The evaluation also took place within the context of COVID-19 pandemic. So a lot of challenges, and obviously COVID-19 pandemic came initially as a health challenge, but due to lockdowns and restrictions, it snowballed into a socio-economic challenge, with the loss of means of livelihoods and all that. So one of the key findings across this evaluation report is that Nigeria has first mainstream the relevant SDGs, SDG 3 and SDG 4, into the sectoral policies and plans of the Ministry of Health and that of Ministry of Education, and that there are policies and programs that are already being implemented that have the capacity to fast track the achievement of both SDG 3 and SDG 4. We've also realized that in some jurisdiction or in some integral component of the Federal Republic, even when you bring more about resources, we will be still facing challenges in achieving especially the health outcome. It is clear from the report that when you increase investment in education, most of the indicators and targets will be on track. But evidently challenges exist in terms of the number of out-of-school children that we have, and in terms of numeracy and literacy skills, at the various levels, primary and secondary. So largely enrollment has increased, but then we still have the challenges of the out-of-school children, and that we need to deal with. And therefore, one of the key findings is to come up with policies and programs that will address the out-of-school children. And incidentally, the federal government has already inaugurated the alternate school program, which will largely address the out-of-school children phenomena across the country. On the health component, we also realized that it's not really about financial resources, that there are more to do with socio-cultural issues. Like, for example, there are some parts of this country that even if you have the best health facility in those communities, uptake of basic healthcare service delivery will remain a challenge. For example, in some parts of the country, it's considered, a sign of weakness for a pregnant woman to deliver in a health facility. So that sort of challenge, we need to do something extraordinary in terms of sensitization, advocacy, and awareness creation around the need to go to hospital to access medical care. So these are some of the key findings. Obviously, with the mixed report that just came out, child mortality has reduced. Maternal health has improved, and all of this will enable Nigeria, as we prepare to present our third voluntary national review in 2023, to harvest these findings and make presentation for learning and evidence-based reporting.